This is a super common problem. It's a big issue, like macro zoom out, not Winchester, just healthcare in general in the United States. The forces that are at play are not advantageous to people who are providing healthcare and went into medicine for the right reasons, or the patients, right? Because we have all these third-party payers and big health systems in the game, and so unfortunately, what you're feeling is super common, and so this type of healthcare really solves that. It allows it to be personalized. We don't have to push for high volume during the day because that's not how we make money, right? If we provide really good care to our patients, they stay on with our practice. And so it incentivizes us as providers to do a good job for our patients. And that's really the way healthcare was designed before health insurance got involved, back in like 1940s.
Welcome to the Real TFC podcast, where we educate and give different perspectives on the local real estate trends from business owners, professionals, and others as we navigate the ever-changing world of real estate. I'm your host, Chris, joined by my co-host, Michelle, as we dive into the twists and turns of the complex real estate world. How you doing today, Michelle?
I'm doing good.
Good. Hey, have you been sick lately in recent past? Or because I was feeling under the weather the other day, and I'll tell you one thing that drives me nuts about, and the reason I don't go to the doctor very often, because of the time. The time it takes to set up an appointment, to finally actually get in and just get there. It just never works out to fit into my schedule. Do you ever have that problem? Or do you ever feel like you just don't want to go to doctors because of the time it takes? It's all involved.
I know. I hate to go.
Yeah.
I hate to go. You get there when you're supposed to be there, and you usually sit and wait.
The other thing is some of the doctors, one of mine included, if you don't show up on time, you're late, they're going to charge you.
And they turn you away and make you reschedule.
Yeah, exactly. But if I'm there early, I can't charge them for being early.
You know what? We have that conversation all the time.
Yeah, or I sit in there and it goes past my appointment. I'm like, well, I had an appointment. I should be in there on time.
And then you're sitting in the waiting room with a lot of people that are there because they're sick.
Yes.
Yeah.
And if you have kids, and if you're the only parent at the time, so your spouse is at work, you got to take all the kids with you. You're like, my other kids are going to get sick too.
Exactly.
Yeah. So anyway, I think we have someone that's coming on the show today that might be able to have a solution to that problem.
Oh, great.
Yeah. So we're excited to bring her on. So let's go ahead and let's welcome her to the show.
All right. Sounds good.
All right, welcome to the show. We have Kelly Botta. How you doing today?
I'm doing well. Thanks for having me.
No, thanks for being here. Glad you made it. And we're going to dive into some really cool stuff today.
All right.
And I think everyone's going to be excited, and everyone's got to listen all the way to the end, right? All right, but before we dive into a lot of the details, let's go ahead and let's start. Let's people need to get to know who you are. So tell us about yourself, a little, where are you from, what brought you here, your education, your family, whatever you want to talk about.
All right. Well, thanks so much for having me, and I'm excited to talk with you guys today. I'm Kelly Botta, like you said. Yeah. I'm a physician assistant, and I actually moved to the Winchester area to come to Shenandoah University and get master's degree training here. Ended up meeting my husband here, and we stuck. Okay. So here we are, 15 years later. We've got 3 children now. They're part of my story, and we'll probably get into that later, but why I decided to do this health school practice. I've got 3 kids, 2 girls and a boy, and they're the light of my life and the reason why I decided to start my own thing.
Yeah, we can both relate to that for sure. So Smartypants, Smartypants medicine, right?
You got it.
So tell me a little, where did the name come from?
Oh man, it's always
is this an okay story?
Oh yeah. It's always fun to think about. So when I left traditional practice about 4.5 years ago, I was trying to find a way to practice medicine sustainably, and I thought I certainly can't be the only person who left healthcare, wanted to practice medicine but didn't like the system. And so I was searching on Google actually, and just like researching sustainable ways to practice medicine, and I found this model of primary care called direct primary care. And I had never heard of it before. And I was reading about it, and it honestly sounded too good to be true. I thought it was fake. And I just thought this was So I just thought this was the smartest way to practice medicine for patients and providers that I had ever heard of. So I ended up calling around to a bunch of different cold calling offices just to see like where these actual practices, the providers, physicians and NPs and PAs that I talked to were so positive about the environment they were now working in. And so I just thought this is really smart. And so spitballing off that idea, I was like, I call my kids Smartypants all the time, like smart patients, smart healthcare. I think I'm just going to go for that. I didn't want to have something that sounded like Apple Blossom or Shenandoah that are kind of common medical practice names around here. This is a different way to get healthcare. And so I wanted people to remember that and just decided to go for it.
Yeah, no, I mean, I can relate to the naming of things because I get a lot of comments about, Realty FC. What does the FC stand for?
Yeah.
Do you have any guesses?
I don't know.
Okay,
I've wondered that myself, actually.
Yeah, I'm glad you asked because it stands for football club. I'm a kind of a soccer guy, so that's the European version of soccer is football club. So, I coached, I played, and all that kind of stuff, and so I kind of meshed two of my passions together, and Realty FC is how that came about.
I love that.
So anyway, so the patients that you have, what is maybe one of the things that the patients love, about what you're offering?
Sure. I think one of the primary reasons people are looking for a different solution with their medical care is that, quite frankly, you guys hit on it in your intro, but it's inconvenient to access medical care.
Yeah.
And we all need it, whether it's for preventative or for acute sick care. We all need to interact with the health system at some point, and it's super obnoxious to interact with.
Yeah.
And so I think the convenience of what we offer is just bar none. And so that's mostly what pulls people, I think.
So convenience, probably the main driving factor to the non-traditional approach.
I think convenience, yeah. The main tenets of this are financial transparency. Mm-hmm. It's affordable healthcare, which you don't usually hear those two words in the same sentence, right? So affordability is a big deal, convenience, and then personalized care. Mm-hmm. You guys know as well as I do, the pace at which you're seen in an office was one of the things that I didn't like about practicing anymore. You're pushed really quickly. And
That's true. I've been with the same primary doctor for a lot of years, and I love her. She's gotten me through a lot of events through my life.
Sure.
But I noticed the last few times that I went to see her, because she's under a big group now, mm-hmm. and I'm in and out. There, mm-hmm. It's like no time to talk about things that you need to talk about.
And this is a super common problem. It's a big issue, like macro zoom out, not Winchester, just healthcare in general in the United States. Mm-hmm. The forces that are at play are not advantageous to people who are providing healthcare and went into medicine for the right reasons, or the patients, right? Because we have all these third-party payers and big health systems in the game, and so unfortunately, what you're feeling is super common. And so this type of healthcare really solves that. It allows it to be personalized. We don't have to push for high volume during the day because that's not how we make money, right? If we provide really good care to our patients, they stay on with our practice. And so it incentivizes us as providers to do a good job for our patients. And that's really the way healthcare was designed before health insurance got involved, back in like 1940s.
Yeah, so with that said, help me understand, is this a replacement of insurance, or do you still accept insurance, or?
I'm so glad you asked.
Yeah, and the reason I ask is because now this is how we kind of spin it into real estate, because we're self-employed, and we need to go out and we need to get our own insurance.
Absolutely.
So I'm wondering if this is an alternative to that.
It's a great question. So it is not insurance.
Okay.
It's healthcare.
Okay,
right?
Gotcha.
So we provide primary care, acute care, chronic care, all that stuff. We provide the medical care, but it is not insurance. So catastrophic care is still something that we recommend our patients to pick up. About 75-80% of our practice still has a high deductible health plan with some type of catastrophic coverage if you have to have a surgery, something like that. But the data shows is about 80 to 90% of medical care over your lifetime is actually, you can have that done in primary care.
Yeah.
So the bulk of what you do really is in-house with us. And so we control that cost. It's a monthly flat rate. You can budget for it. There's no surprise fees, right? So that's really helpful in this season of life when everything's exponentially increasing, that you can kind of budget out your healthcare costs. And then you have that high deductible plan sitting on the side. So in case something happens, but really the intent is we keep you in your medical home with us at the practice. And so really you're only straying outside of that if something catastrophic is going on.
So you're talking about we can budget for it. Help me understand that. So is it like it's a fixed cost for the service?
It is. It's a membership medicine program.
Okay.
So it's very similar to concierge medicine in that way. And I think that's what most people have familiarity with is concierge medicine. But direct primary care is not an idea I came up with. It's growing across the country, but it's a membership model for medicine that doesn't participate with insurance. And that sounds scary to us because we're all used to that. But that keeps the cost low.
Yeah.
So concierge medicine, it is concierge medicine. It's just that we don't bill you and bill your insurance on top of that. So you don't come to me and pay a copay. You pay a flat monthly rate. it covers whatever you need that month. You might need to be seen 3 times if you're sick.
Yeah.
You know, you might call me on the phone and you get poison ivy, and we do a telehealth visit, and I can diagnose that over telehealth, and you don't pay for that visit, right? It's just a monthly flat rate. And the idea is, you know, the better care we do, you guys stay on, and then it spreads that cost. You're not going to need me 4 times every month. You know,
Yeah.
some months you're going to be healthy and some months you're not. And so it works out for us financially and helps us predict as a business, you know, our costs, and it works out for you guys as patients. You have access whenever you need it,
Yeah.
just like concierge medicine. But you don't have these long wait times. You don't have these high unknown bills, and then we're not billing you plus billing your insurance. And so it keeps the cost a lot more manageable.
Yeah, and I don't want to give too many details, but I just have more questions. So.
Yeah, and we partner with small employers and lots of independent.
Yeah,
I mean,
we'll
I have a
get
lot
into
of
that.
folks
We'll
like
get
you
into that
guys on
later.
my panel, because this is a solution for the self-employed. It really is.
Yeah, so is it a membership like for kids? Is it a membership per kid, or is it a membership per family? What does that
Yep.
look like?
So my specific practice, we don't see pediatrics, so we're adult only. We're internal
Okay.
medicine, and that's based on how I was trained and the physician that I work with. But a lot of direct primary care practices do. There's one in Front Royal actually that they see kids. There's some practices. The closest one to us is in Manassas, out that way, and south. The one in Front Royal started a year or 2 ago, but before that, it was like all the way down to an hour and a half away. Right.
Yeah.
So that's why I started one that wasn't here. But you pay by the person, and then there is a family rate so that we're not, you know, endlessly charging people.
I gotcha.
So once you hit 3 people, it's kind of it's capped that way.
Okay.
Yeah.
Okay, good. Well, this area is growing, so I'm sure the number of customers are going to continue to grow for you as well.
Yeah, we all need healthcare, that's for sure.
Yeah. And you're right about, you know, a lot of getting sick on a normal basis could easily go just, you know, to you for something like that. It's usually not, and we all pray that nothing catastrophic happens.
Right.
But it's nice to have that.
Right, yeah,
in
and
the
it
event
keeps
that
you guys
happens.
out of the, even though like right now the system's set up so that, you know, you obviously have the ER for your high cost, really severe stuff, and you've kind of got the safety net of the urgent cares.
Yeah.
The trouble is the way those are set up, like is really close to what we do in primary care. I won't say they're the same. They have some more services, but the cost is just astronomically more expensive. And so
Right.
to provide affordable care for people is a real moral win for us. You know, it makes us feel good about the care we're providing, and then it does meet a need in the community. So it's been exciting. Yeah.
Okay, great. You know, and this next question I have is I really enjoy, you know, asking entrepreneurs this question because they usually have a really good story. So I'm not setting you up or stealing your thunder. What motivated
Pressure.
you to start the business?
Yeah, I was practicing medicine. I love medicine. I'm a nerd,
Yeah.
right? Met my husband in anatomy class. Like, we're super nerds, and so I love medicine.
Super nerd.
We
Okay, that's a whole
are.
nother level.
We're super nerds, but it's okay. Works for us. And so I was practicing medicine in a private practice. And the short of the long is we got bought out by a big local health system. Worked for them for a couple of years. Started to get administrative stuff, and I really didn't know at the time I was burned out.
Yeah.
This is pre-COVID. We didn't talk about this in healthcare. We hardly talk about this in healthcare ever. We definitely didn't talk about this pre-COVID. So I didn't ever even heard that term. But I just come back from having my second child. So I had two little ones at home. I'm working 12 to 13-hour days. And I just thought, like, I don't want to do this. I can't be the mom and wife that I want to be and practice medicine, which put me in a bad spot because I love both of those things. So like I was telling you before, I just decided to try and find a better way. So I resigned my job with no real plan, but knew I would be practicing medicine at some capacity. And just COVID happened 3 months later and gave me a lot of time at home to figure it out and research. And so I actually started the practice during COVID because I missed practicing medicine, and there was no jobs to pick up. There was no hours, right? I was planning to work per diem, but there was nothing. And so I really feel like, you know, God kind of aligned my path for that to happen and allowed me to find direct primary care. And as I talked to my husband about it, I was saying, like, I wish I could go work for one of these practices, but the closest ones were, you know, an hour and a half away. So it didn't solve the time problem for me. And so he suggested I start one, and so we went for it.
Okay, and for the traditional medicine places,
Yeah.
what do you see that as being the biggest challenge for them? I mean, is it that you have to go to that location? I know we kind of talked about it a little bit, but is that what you kind of see as
For the
biggest
patient
challenge
side
from the patient
from
side?
the patient side, yeah. I think probably, in my opinion, the biggest problem is access to care.
Okay.
You know, so that's a big buzzword in our world. But what that means is when you need help, you can get it, and you don't have to wait for it. And that's a big problem with our current system because of the way the payment model is set up. The employers really want to fill the schedule with people so that they have guaranteed income, right? And that's fine. Healthcare, it's a business. In the end, they need to make money as well. We're all there to provide for our families, so I understand that. But there's no gaps in the schedule to be able to take care of patients who are sick. And so then when your people really need you and they're in a desperate spot, you got a longer wait than you should, or you're getting bumped over to an urgent care or an ER where really we should be taking care of our patients in our own practices. We know them the best, and we know their history. They walk in the door and I know you don't look right? Because I know you. And so there's value to that in practicing medicine. And so I think that's the biggest thing that patients don't have in the current system. And there's data actually that shows having poor access causes worse outcomes health-wise. So more disease, more mortality, more cost. So we have to fix that. And the system knows that. I mean, healthcare in general, all the administration, they're trying to do their best, but the system just isn't set up for an easy solution for that. And so, people who think like me and who are providers and been doing this a while, it's like, we really need to, you can't fix this really. We kind of need to go over here and just start over. And so at least in my world in outpatient, in the hospital it's a little different, but in outpatient world, we're able to do that this way. And so that's really amazing because it's both good for you and better for us also.
Right.
Yeah.
Yeah, it seems like for me, whenever I get sick, I'm feeling really bad. I call the doctor and they're like, okay, we can get you in tomorrow or 2 days from now. I'm like, I feel really bad right now.
Yeah.
And then by the time I get in there, I'm like, you know what? I already starting to feel better. I really don't need, I got to pay this copay. I really don't need to come in here. But it would have been nice to have something to get me through that day. I wasn't feeling really bad. So I can.
Absolutely. So, just to piggyback on that.
Yeah.
So when we talked about convenience earlier, what that practically looks like, people may not know if they're not hopping on the website and seeing what we do. But in this style of care, they get their provider, so me, they get your PCP's phone number that you can text with. And so you can text, you can call, it comes to our phone, right? They have our personal emails. And so we're able to help you guys navigate that, right? So you might feel really bad and say, hey, I need to talk today. I don't feel really good. We get on the phone, we talk, we do kind of a triage on the phone. And then I say, okay, well, let's try X, Y, and Z. Text me tomorrow. I'll come see you if you're not doing well. Okay. Or why don't we go ahead and try these two things? Or actually, no, I need to see you today. I'll be there,
Yeah.
And so it gives you access to the decision makers for your own health so that you're not having to go through all these people at the front end who are gatekeeping to your provider, right?
Yeah.
And so that's a huge benefit to people.
And you're responding the same day?
Yeah, same day. Yeah. I might miss one every once in a while. I'm human, but yeah, my patients know if they don't get a text back the same day, I probably missed it, right? It probably got lost in my text string.
Yeah.
And so we have safeties in place for that, but they also know you don't text if it's urgent. So we have some things set up, but it's a very fun way to practice medicine because you really can help people navigate these things in an efficient way. They're not having to take off work to come ask me, do I need to care about this, right? We can have a 5-minute conversation. So it's been pretty fun.
That's awesome. And what does the onboarding process look like for, someone that wants to be a new patient? I mean, is there a several day study period type of thing? What does that look like?
It's easy.
Okay, easy.
Yeah,
That's
so you hop on the website, smartypantsmedicine.com. There's a sign up button. You click that. Right now we're on a short wait list because I'm at capacity right now. But you'll get an enrollment link. You fill out your history online. We message you and set you up for an appointment. So that first month is a little bit more intense because we want to really get to know our people and do personalized care. So we have to take our time. We can't do that in a 20-minute visit. So we spend an hour with you on a telehealth visit, and we do your new patient intake. We go through your whole history, see what your priorities are, what's your health goals. Do you have any?
Yeah.
Do you just want us for sick care, or are you trying to quit X, Y, and Z? Are you trying to lose weight? What are you trying to do? And then we can partner together on that, and then we follow up with another hour-long in-person health call to set up a plan for you. And then after that, we execute the plan however you want it to look.
Okay, and so you've been successful. You say you're at capacity, which is great. And I'm always curious in real estate. We're always looking for clients and customers.
Yeah.
What was successful for you from a marketing standpoint, or how'd you get the word out?
Yeah, I have to admit, 2 things I think are the best.
Hold on, let me write these down.
Okay, you probably already know. Yeah. You're doing this, so you already know.
All right, okay, it's recorded.
No, social media is amazing,
Yeah,
right?
okay.
And so people in my profession, we don't really do social media. When do you ever see your doctor on social media? That's not a thing, right? But that is a thing in direct primary care world. We're trying to go directly to our patients and give them information that's useful, and also let them know, like, we're human too. Right. And so we know so much about our patients' lives, and it's really one-sided if you think about it in the healthcare system. And what we're doing is really doing personalized care, and we're coming to your house, so we know each other, my family, and there's a certain accountability and respect level that's neat with that. So social media has been great, and then people share that stuff. I try and put educational content on there. And then the other big thing is just locally, I can't say enough about the Chamber of Commerce. Okay. I've had a lot of really great connections through there, and so showing up at those events has been pivotal.
Events,
and a lot of small business owners I have as patients, and y'all talk. So if we solve a problem well for somebody, then people talk. So referrals are the 100% the best way. But if you were going strictly in the marketing lane, I would say chamber and social media.
Was it hard to get up and running? I mean, how was you accepted in the community when you first put this out there?
Like I said, it was weird as a healthcare provider to be going to marketing events, right? Because I don't ever had to do that. I just come in the office. There's people on my schedule, And so I think for other people who are maybe thinking about doing what I'm doing, you definitely need to consider that, because I'm pretty outgoing. And if I wasn't, I don't know that we would be as successful, because you do have to put yourself out there, and nobody has ever heard of this before. Right. So you have to be willing to educate and speak and, do all of that kind of stuff. So it's been an experience, but it's been good. And the other thing, I have to give a shout out to my husband. He let me take this jump, right? So we planned to do this financially so that I could go down for a while and slow grow this as a mom and not have to go pedal to the metal. So I think if I was in a different scenario, I may have marketed different, right? Okay. But I had the luxury, and I actually preferred to slow grow.
Yeah.
In this
do
season.
It the right way.
Yeah, in this season of my life. Yeah. And sometimes I think, I had several business owners when I was starting tell me growing too quickly is actually terrible for you. Yeah. And so I really took that to heart, and it also fit my season of life. So that was kind of easy to listen to. And that's ended up working out for us.
Yeah. So, a lot of doctors don't use social media. Well, every real estate agent uses social media. So we have to somehow be extra, or have material that is more engaging than the other real estate agents. So
it's a huge challenge for you guys.
It is.
Yeah, it is. But props to you. I mean, this is an amazing setup that you have. I love what you're doing.
Well, Absolute Altitude, definitely. They're the ones that set it up. We just show up.
We show up. Yeah.
Yeah. It's hard work to create content and find guests though. So it's definitely an effort. You guys are doing a great job.
And what areas would you say currently that you cover for your patients?
Geographically?
Yeah, geographically.
Yeah. We do a 30-minute radius around the center of Winchester. Okay. And so that takes us kind of out to Berryville, up to Lake Holiday, over out to Gore, down to Front Royal. That's kind of the four corners, if you will. And then I will travel out to 45 minutes. I've got some patients out towards Bluemont. There's a travel fee if I'm out that far. Okay. For those things, like I said, a lot is done remotely, so it's not often, but that's our radius right now.
Yeah, wow. Just imagine because you're at capacity now, and if you went further out than that, you'd need extra people. You need to start hiring people.
Absolutely.
Is that thought come up? Scale yourself here at this point?
Yeah, it is. One of my missions with the business is to be able to provide this solution for other healthcare providers who are looking for a similar solution. A lot of people are getting burnt out in the current system, and they want a solution. Yeah. And instead of walking away from medicine altogether, and that hurts our community, now we have even less people to take care, of our community, is to provide another option. Not everyone's going to fit in this option that I'm providing, but if we've got, a lot of different options, then providers and patients can pick what fits for them. And so I would love that. That's definitely one of our goals. It's on the 5-year, and we're coming up on that. So we're poised to hit it, but not quite yet.
Well, I feel like it makes sense. If I'm thinking of my family, we have 4 kids. So if one's sick, trying to schlep them all out at once is just, that's a task in itself. So I definitely see a need, or I guess it's nice for families like that.
Yeah. Professionals, right? People are busy. Time is everything.
Yeah.
And so, us being able to close that gap a little bit for people, for us to not have these appointment lags that you guys mentioned. My schedule doesn't have 25 people on it. Yeah. That I'm squeezing into an 8-9 hour day. I've got like 8, maybe 4, and so we don't have the time crunch that you feel in a traditional practice, and patients really appreciate that.
Now, you don't have a physical location, right? Do you ever see the need? Is that part of the plan, or is that kind of changed the business model entirely of actually having a physical location? Do you think it would make it better?
Yeah, I do actually. So we're moving in that direction. I didn't have that in my mind initially. This was like a kind of a grand experiment. Like, could this work for my family was where we started.
Yeah.
And then what I realized was there was a lot bigger need in our community than I realized at the time. And so kind of the more I learned as the business grew, that started changing my mindset, right? And so to be able to bring on other providers and scale, it doesn't make sense for us all to house call. I also did some feedback surveys with my panel of people, and people want a physical location. Like, that surprised me a little bit because that's who I've attracted. But some people do want a physical location. And we were close to 50-50 split on that. And so that's something that we're moving towards. Hopefully we'll have done by the end of this year. And then we'll still keep the house calls, but then we'll have a location. So a couple upsides to that I thought through, you guys might be interested in it again as owners and known in real estate, but obviously the house call piece will stay. For procedures, we try and keep a lot of stuff in-house. So if you need skin biopsies or you have a simple laceration that you would go to the urgent care for, we can do the simple stuff. And so we can manage that. I bring all that to the house right now. But if we could do that, we could do it more efficiently for patients to not have to set all that stuff up and then do their procedure. And then I got to pack all that stuff up, and pack it out. So for procedures and stuff that are scheduled, it'd be more efficient for patients to come to the practice location. And then I also work with several small businesses. And I don't think we've talked about that yet, but
Next question.
Yeah. Aside from individuals and families, I work with local small employers who either want something more personalized and just quite frankly better for their employees so that they actually get healthy, or who are priced out of the health insurance market and they can provide us in primary care and acute care, but they can't really afford to buy full commercial insurance, right? And so we have some businesses like that. And then we have some who've used us as an add-on. So they offer a high deductible plan plus our practice. And they cover the cost for their employees as it's not expensive, right?
Yeah.
And it's a benefit now. And it's, employee retention is a huge issue for employers right now. So that's been something we've been getting into that market. Again, that feels really good. These are small employers who don't have a solution right now. And so for them, a location is going to be such an upgrade. Right now, I go on site to their businesses. But you can imagine that gets a little bit tricky. Like if I'm taking care of a spouse, then that's different. Or if they're sick and maybe we don't want them coming into the business to expose other people to that. So it's been a little bit complicated to navigate. And I think this will make that a lot more smooth for the local small employers that have come on with us.
Okay, interesting.
Yeah.
That's a good option. We'll have to talk about that.
Yeah.
off
Would
camera.
love to. Would be happy to.
All right, Kelly, thanks for coming on to the show. It's been awesome. Hopefully a lot of information was taken by the listeners and they contact you.
Yeah. Thank you so much for having me, you guys.
Yes,
I really
thanks,
appreciate
Kelly.
it, Chris and Michelle.
All right. Well, thanks for tuning into the Real TFC podcast. The key to success is knowledge and relationships. So please like, share, and subscribe, and catch you on the next episode of the Real TFC podcast.